It's very common, and what happens is that the veins in the legs are supposed to take blood up to the heart, and because we live most of our lives upright, there's this constant gravity pressure against that flow of blood, and some people have weaker vein walls in their legs than others, and it's usually just a family trait. But with all that gravity pressure, the vein walls in the legs where the gravity pressure is greatest, they can dilate, the valves inside can start to fail, and the blood can, instead of flowing upwards toward the heart, can flow backwards, and that's a process that we call reflux or incompetence of the valves. And that underlying reflux and pressure of gravity is the whole problem with chronic venous disease. It's why people get varicose veins, the dilated veins under the skin, and with time, unfortunately, the skin of the legs doesn't like that pressure, that venous pressure, and so the skin in the lower part of the legs can even break down and ulcerate, and that's the more chronic, sort of more severe stages of chronic venous insufficiency is this venous ulceration.
I started noticing a problem with my leg vein, especially the left leg, about a year ago. The nature of the job I was in at that time for the past 20 years is a lot of standing. And currently I now work in a medical surgical office. I do a lot of sitting now, and there's a lot of pressure on the back of my leg. And I just feel that that has exacerbated the symptoms that I do feel, which is a lot of pain, throbbing, and fullness in the vessel, and it's bothersome to me. I decided to have the laser treatment as opposed to surgical stripping because I work in an operating room, so I've seen the open/stripping procedure, and it is more invasive. You have to undergo either a general anesthetic where you have medication put into you to put you to sleep, or you have to have a spinal anesthetic, which is quite invasive. It's a needle in the back, and the procedure itself is more invasive, involves more opening of all your tissues, therefore it would take longer to recover from. And I just think that healthcare and medicine, the EVLT is a step in the right direction. It's the future of medicine. It's less invasive. My recovery time will be much, much quicker.
The overall results, if anything, according to the world literature, it seems to be that these newer endovenous procedures are even more effective than surgical stripping in terms of patient satisfaction, and even going back with ultrasound and looking 3 months later, 1 year later, 5 years later, the overall effect in terms of getting rid of that saphenous reflux and the venous hemodynamics of the legs, it seems to be better with these newer procedures.
The outcomes that I hope to get by doing the EVLT is that I would no longer feel any of the pain and the fullness and the throbbing, and cosmetically I hope for a good outcome.